So the Government of India, through Ministry of Health, is launching an initiative to foster medical tourism in India. The initiative is being called Heal in India. India has a definitive cost advantage in healthcare over other emerging and developing nations. For example, a heart bypass surgery may cost you about 140,000 to 150,000 US dollars in the US. It may cost you around 15,000 to 20,000 dollars in Singapore. But in India, one can get it done in anywhere around 4 to 6,000 US dollars. Indian hospitals and diagnostic centers are likely to be the key beneficiaries of medical tourism. Pre-COVID, medical tourism used to contribute anywhere around 10 to 15% of the revenues for most private hospital chains in India. However, since COVID restricted international travel, this number came down to almost zero in 2021. Now, this was adversely impacting the margins of hospitals in that period. However, the hospitals continued to improve their operational efficiencies by doing more cost rationalization. In the most recent quarter, the contribution of medical tourism to revenue to these hospital chains has now gone back up to 6 to 8% since international travel has started but not completely normalized. But it is still far away from the pre-COVID levels of 10 to 15% of top line. In our assessment, medical tourism is the highest margin business for hospital chains in India. However, despite low contribution from this segment, Indian hospitals are already reporting highest ever margins. This has been driven by cost rationalization, increase in pricing of services, unbundling of pricing, etc. etc. We believe that hospitals in India will continue to report better margins as medical tourism normalizes in coming quarters. Further, with the help of the government, the medical tourism contribution to top line should eventually exceed the pre-COVID levels of 10 to 15% because that was done completely on the hospital's own initiative, and now the government is going to help them in the initiative. This higher contribution to revenue compared to pre-COVID levels should lead to higher ROEs and higher margins compared to pre-COVID levels, and hence in re-rating of these stocks and higher earnings growth than what historically these chains have been able to exhibit. We at InCred Healthcare PMS are overweight hospitals when compared to our peers and our benchmark. Thanks.